Hi, this presentation today is about advocacy, patients as experts. Last year, I was honored to present a statement for Autoimmune Hemolytic Awareness Day, and I'm honored to be able to present this again this year. I think it's particularly important to lift voices this year as medical research is in crisis, and the FDA NIH Rare Disease Day, a worldwide event that was originally scheduled for February 28th, has been postponed. Many thanks to Waha Warriors and the Cold Agglutinin Disease Foundation for sponsoring this day. My name is Mallen. I'm a writer and a former teacher, tutor, and small nonprofit founder and director. In my free time, I garden, hike, bake, and bike. I was diagnosed with autoimmune hemolytic anemia in 2013, both the warm AIHA and cold agglutinin disease. Both are rare, but the incidence of having the two together is considered less than 1 in a million. In medical research, rare diseases are often called zebras. The reason is that doctors are taught that if they hear hooves, they should think horse. Illnesses usually fit clear, common patterns, yet occasionally the sound of hoofs is due to something atypical, hence zebras. And my status goes a bit further. I'm considered a medical unicorn, almost mythological in its occurrence. No typical doctor would suspect what's going on in my blood. It took a while for my hematologist to figure it out in 2013 after my blood had clotted 3 times and gummed up his automatic analyzer. He told me he'd heard of a cold agglutinin disease as an intern, but he'd never seen it in all of his years as a doctor, and he was near retirement. My conditions, warm autoimmune hemolytic anemia and cold agglutinin disease, are considered secondary to lupus and monoclonal gammopathy, respectively. This means there are 2 ways that my immune system mistakenly targets and destroys my red blood cells. My symptoms are varied over the last 12 years, from mild and moderate anemia, shortness of breath, heart arrhythmias, low oxygen, elevated bilirubin, the beginning signs of some organ damage. I have a higher risk of blood clots, and both diseases can be life-threatening. These are not typical anemias, and they cannot be fixed by taking iron. In fact, my iron has been dangerously high at toxic levels at times due to the long-term hemolysis, my body killing off the red blood cells. So I've had to avoid certain supplements and eat a low iron diet and be monitored carefully. Some patients with AIHA need to take strong chelation drugs to lower their iron levels, but so far I've been able to avoid this. Living with this is not easy, and my hemoglobin has been abnormally low for over a decade, only recently normal after treatment. Many doctors, nurses, phlebotomists, and ER professionals have never heard of it. I do my best to educate them on the challenges of drawing my blood for testing. My cold agglutinins will clump the red blood cells together if the collection tube isn't kept warm and the blood processed immediately. These medical professionals often don't believe me, even though I have a printed card from the Cold Agglutinin Disease Foundation, and they often don't understand the ramifications for their own workday if they collect my blood the usual way. It will clot the analyzer machine and require them to stop processing, open the machine, and clean it out. This can delay everyone's blood work as it halts the process in the lab. I can no longer get routine blood work at Quest or LabCorp, as those commercial labs will refrigerate the blood and send it out to be analyzed. If the test is only on serum, it is possible for them to run it at a commercial lab, but something as simple as getting blood work is fraught with roadblocks for patients with cold agglutinin disease. I'm lucky that I'm a snowbird. My husband and I live in Pittsburgh, Pennsylvania for the warmer months, and West Palm Beach, Florida during the winter. And at the University of Miami, my hematologist recently asked if I was going to continue this back and forth, and I said, yes, I think I'll live longer if I avoid winter. And his answer was yes, quite literally. It's incredibly scary to know that most doctors do not understand the mechanism of my diseases. For instance, during flares and drops in my hemoglobin, 3 times I suffered severe flank pain, prompting outpatient imaging. But one of those times I ended up in the emergency room in a community hospital here in Florida as the pain was so intense. They gave me IV pain medication, and the doctor ordered a CT scan. And not only did the phlebotomist argue with me about how to collect my blood, the ER doctor diagnosed me with a simple gastritis, inflammation of the stomach, and sent me home. But recently I learned from the University of Miami specialist that my episode of pain was due to my spleen being overwhelmed by trying to process all the dead red blood cells. I spoke with that same hematologist about an emergency department visit last year in another community hospital here in West Palm Beach. And again, the phlebotomist didn't believe that my blood needed to be kept warm and announced that they had no warmer packs in stock. And I explained that they would have to do something to keep the vials warm. And I suggested they put them in a cup of warm water, which is the way it was done when I was first diagnosed. And later, after seeing the results of the blood work, the ER doctor was confused and didn't believe that my hemoglobin could drop so quickly in 2 days without any evidence of internal bleeding. So he repeated the CBC. Two of my physicians at the University of Pittsburgh said I should have been admitted that day and that I needed new doctors in Florida. So they offered to find me someone at a teaching hospital. And they did. The University of Miami hematologist is now my current hematologist. And when I explained all this to him, he said, you really can't blame these doctors. It's not even their fault. They deal with bread and butter, and they do this all day, every day. And they're really good at dealing with bread and butter. They know what to do with bread and butter. But then you show up with this weird fig jam. And I laughed at that response because I do sort of feel like a fig jam, thick, dense, slightly sweet, but also tart and fibrous with lots of tiny seeds. Lots of things are going on. Medical professionals often call me complex. So one of the things I think is so important regarding rare diseases is the need for a specialist. Usually that means someone in a teaching hospital or in a university setting. A doctor must be willing to research and ponder a rare disease. My current hematologist told me I should understand there are no real protocols for patients like me. Thankfully, there are options for treatments, and doctors only have, unfortunately, access to research studies with very small numbers because there are so few of us. They can read what experts in the field suggest, but they have to understand the mechanism of the disease in any patient so treatment can be customized. Some patients with autoimmune hemolytic anemia suffer short-term acute bouts associated with affections that eventually will resolve on their own. But for those of us with the chronic versions of autoimmune hemolytic anemia, doctors often try multiple therapeutic options to see what works best. It's encouraging to me that researchers are identifying the impact of this disease on quality of life and that it's significant. Recent studies report difficulties with fatigue, mental health challenges, and living in uncertainty, and I can attest to all of those. In the journal, Expert Review of Clinical Immunology, researchers identified the multiple domains of quality of life that are affected. And those include daily living, working, leisure, and even sleep. And again, I can identify. Last year in April, I had my third bone marrow biopsy. It took almost 3 weeks for the results, and my hematologist called me to say it showed a possible B-cell lymphoma. Multiple pathologists reviewed the slides at both the University of Pittsburgh and the University of Miami, and there was an additional review of my first slides from the first bone marrow biopsy back in 2015. They all agreed on the findings that the current differential diagnosis includes a rare indolent B-cell lymphoma. Yet my hematologists at both institutions believe that the autoimmune hemolytic anemia might simply be acting like a lymphoma. Cold agglutinin disease is considered its own unique lymphoproliferative disorder. But either way, this did not change the preliminary treatment plan. I went through a series of Rituxan, a round of Rituxan, 4 all-day infusions once a week, and I had a great response. My hematologist just confirmed last week that I'm in clinical remission. Unfortunately, Rituxan, a targeted therapy that reduces those problematic B cells and also the normal B cells, doesn't cure this, and the effects tend to last 9 months to a year for most patients. Some people get a little bit more. I'm scheduled for monthly blood work to watch for any changes, and then we'll figure out what to do from there. I've been on Social Security disability for 2 decades now. My rheumatologist insisted I file as he felt I'd live longer if I stopped working full-time as a teacher. I followed his advice and I was approved right away. I did a bit of part-time tutoring. I dabbled in writing. I volunteered for a nonprofit. Even though these were part-time activities, I imagined when my husband, a chiropractor, retired, I would stop volunteering as well. Yet a short time after he sold his practice 2 years ago, I published an essay in HuffPost Personal about the challenges of being immunocompromised at the end of the pandemic. It was seen by thousands of readers, and it turned me into a patient advocate, sort of an accidental advocate. I wish I could say that my motivation in writing was a sense of altruism to speak up for all of us. I did write that about 2.7% or approximately 7 million Americans live with a compromised immune system. Yet, to be honest, I was focused on defending my own status. I was using those millions of people to prove that I wasn't being unreasonable in masking and avoiding crowds. There are so many of us who need to still continue to take precautions to have the best chance of simply surviving. And that number seems to be rising. New research from the University of Washington in Seattle by Martinson and Lapham, published in the Journal of the American Medical Association, gives a new estimate of 6.6% immunocompromised Americans using 2021 data, more than twice as high as what was commonly reported. The researchers haven't been able to determine whether this is from the COVID virus itself, as COVID has been linked to autoimmunity, or if there's more of an understanding of what an immunocompromised condition entails. So further research is called for. Yet if autoimmune conditions are indeed increasing, this suggests bringing awareness to these diseases is even more important. At the end of the essay, I shared my vulnerability and asked for people to call or FaceTime, to not forget their family or friends who were, like me, still isolated. Yet, and I completely understand this now, but I didn't at the time, people reached out to me. I received scores of emails describing incredibly challenging situations. 2 people with autoimmune hemolytic anemia contacted me and said they didn't know anyone else with this, as it's so rare. I was able to point them to the Facebook groups Waha Warriors and the Cold Agglutinin Foundation. There were others with family members who'd had organ transplants, cancer, and other types of chronic anemias. All agreed with me about how hard it was to be immunocompromised and shared their feelings about the difficulties that we go through. Reading those emails and responding to each of them touched me deeply. I'm still a bit surprised that I didn't figure this out ahead of time. I was so wrapped up in my own feelings that it didn't occur to me that I was functioning as an advocate, giving a voice to others too. The proverbial phrase fits here: a problem shared is a problem halved. And this is how we all benefit when we function as advocates. Then last year, a representative from a large drug company contacted me. They had read the essay online, and the representative invited me to attend a gathering of other patient advocates. I was skeptical and I didn't understand the invitation at first, but after a few questions and answers back and forth, I agreed to attend. The experience was eye-opening and astounding. Here was a large corporation putting significant efforts towards listening to what patients had to say about their lived experiences with their autoimmune diseases, how it affects our day-to-day lives, our medical treatments, and our appointments. They considered us experts, and so we are. I met other patients with autoimmune diseases doing advocacy work. They're running support groups, writing blogs, telling their stories, sharing other patients' stories, and lobbying Congress. And I decided that I would join them. I've lamented the loss of my professional career, but here was a way to volunteer with organizations where everyone involved understands that I may have to cancel at the last moment. It's important for doctors, nurses, medical professionals, and the public to know a bit about autoimmune hemolytic anemia. And by putting our voices together, we can help further research into this rare condition. It would be wonderful to imagine that our grandchildren wouldn't have to suffer such a thing. I look forward to learning more about new pharmaceuticals currently in development, as well as those that are in clinical trials. And I pray that soon there will be effective, long-lasting treatments, or even a cure, or perhaps maybe a preventative measure so autoimmune hemolytic anemia never develops. It is my hope that no baby, child, or adult will have to live with such a difficult loss of energy. A drop in hemoglobin is a loss of oxygen, which equals a loss of energy. It makes everyday activities hard. If there is a cure for us in the future, we must talk about our experiences, bring awareness to the disease, and build momentum for further research, particularly considering this current research crisis. We can all be advocates. We are all experts. The patient knows most about what it's like to live with the disease. So I'm going to continue to look for ways to speak up, and I thank you for this opportunity. I do appreciate it.